if a patient needs surgery, and always that's the last resort, what can they expect, I guess, from the surgery and from the recovery as well?
So, a lot of people are worried that they waited too long to get the surgery or that they can do a lot of other different things. So, I try and map it out for people that you have such and such symptoms, you have deficits on exam, either sensation or motor. And now the question is, what's the nerve conductions? We look at those to make a decision, are you ready for surgery or not? So, if you do the surgery, it depends on how you do it. All roads lead to Rome. In other words, they're all the ways that we do it, 95% success rate with a 5% recurrence. And so that's with open, mini open, endoscopic, whether it's one portal or two portals, and including now ultrasound with uh, a, uh, a special knife that you do it with ultrasound. And so you can do it through one small incision. And all of these ways allow you to return to work and to using your hand pretty quickly, with the exception of the open. The open method, which is a much bigger incision, so you end up with an incision coming along here, and that takes a bit longer for you to feel comfortable using. But most endoscopics, you can feel pretty comfortable right away. There's a number of times where people might make you afraid that waiting too long would lead to permanent damage. So I'm here to tell you, as a young hand surgeon, I knew I had carpal tunnel, but of course I didn't have time because I had babies, I had surgery, I was every other night call, level one trauma. Well, who's got time? And I kept waiting and waiting, in 7 years to finally
Wow.
get it done. Well, the good news about waiting that 7 years is that the endoscopics became available at the end of that 7 years. So I ended up doing both of my hands at the same time, and then was back to work within 2 weeks. And nowadays, people can really turn around within 1 to 2 weeks of getting back to normal stuff. And if you're typing in an office, you can actually get back pretty quickly. The key is elevate your hands, move them, take some breaks. If you have to remind yourself to get your hands up and move them, set a timer, like one of those oven timers at your desk or your watch, telling you every hour or so, get your hands up, move them, and then get back to doing what you want to do.